My innovation story is about enabling a space, an ecosystem, the regulatory conditions for anyone to become a problem solver. So to feel empowered enough that he or she will dare to imagine and create solutions to the forgotten problems of today's medicine. So think about two stories, one from the East Coast and one from the West Coast. The first one is about a teenager in New York City who invented a sensor that could be worn by his granddad who is suffering from Alzheimer's. And this sensor is made to alert the family each time the patient is leaving the house. Then 6 hours from there, it's about another story. It's about a group of young Californians fascinated by the power of biology who decided to produce open source insulin, showing that community lab in Oakland might one day, drop by drop, tweak by tweak, disrupt the big pharma model for producing drugs. So all these people are innovating. They are citizen innovators. And in their diversity, they present bottom-up models to innovate in medicine. And all these models are actually interesting because they are open, they are collaborative, and they are about sharing space, tools, ideas, ultimately knowledge. That's the beauty of it. Beyond sharing tools and space, you're also sharing, digesting, transforming, acquiring new knowledge, which is the best way to empower every one of us. So from the first makerspace in a US hospital to community biolabs to citizen scientists using serious game to produce better medicines, the world is full of citizens and patients who innovate. I want to tell their stories. I want to capture their imagination and by doing so inspire others. And the storytelling is an important part because we are, as a species, storytellers. And the stories we tell shape our perception of ourselves, and they shape our medical futures. But beyond the storytelling, I also see a need for helping this innovation ecosystem survive, and especially because it operates outside of traditional institutions. So how do you do this? Well, first, I guess you connect the dots. So you map and you connect people who want and need to share space, tools, equipment, knowledge. The hackers, the makers in biology, the doctors, the nurses, and there are problems on which they can work together. For example, what kind of medical device can you build in a hackerspace when you have $500? What kind of biological device can you make when you have $10,000? Those are problems that we need to think about, and those people can unite forces to work on that together. Then there is a need to sustain the innovation effort. So you need to build a long-term capacity for entrepreneurship and for education. And I'm thinking especially about how do you help this ecosystem welcome the next generation? So the high school kids from different social backgrounds who want to become independent learner, who want to learn how to teach, how to think differently. And so that's one goal that ecosystem could actually be working on, and that would be really interesting to develop. Then finally, there is a too often forgotten issue, which is about how do you safeguard, how do you regulate, how do you oversee these commons, these networks of citizen innovators? Because basically it requires you to think about safety, liability, ethics in a 21st century context, right? So how do you think about ethics, safety when you work on a crowdfunding platform? When you get your funding through the crowd, what kind of liability do you have to observe? How do you organize ethics review for this? How do you create the next model for R&B in the 21st century? Those are all questions we need answers for, and it's really tough for our formal governance institutions to actually think around this because they are not used to govern on the edge. They are not used to deal with non-hierarchical systems. And so what you need to build is a culture of responsibility. So it's a form of peer control, a form of peer review that's flexible enough so that it can be vetted by the communities themselves and the rules can be changed by the communities themselves. So ultimately you need to build trust and a form of connective leadership. And that's what we've been thinking about, my colleagues and I, in the Science and Tech Innovation Program for, well, probably the last 7 years. We are based at the Wilson Center. And basically the key question is really, how do you bring back collective empowerment in science, technology, and medical innovation?